With more consistent leadership, we could have saved a lot of lives.
I believe so. I mean, I think if we had the public health messages from the top right through down to the people in the trenches be consistent, that things might have been different. You can't have mixed messaging.
There's a lot of confusion among people and misinformation surrounding face masks. Can you discuss that?
The masks are important for someone who's infected to prevent them from infecting someone else. Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet. When you think masks, you should think of healthcare providers needing them and people who are ill.
But it can lead to a shortage of masks.
Exactly, that's the point. It could lead to a shortage of masks for the people who really need it. But also, it can protect to a certain degree, not 100%, in protecting you from getting infected from someone who either is breathing or coughing or sneezing or singing or whatever it is in which the droplets or the aerosols go out. So masks work. A mask might make people feel a little bit better, and it might even block a droplet. When you look at the films of foreign countries and you see 85% of the people wearing masks, that's fine. That's fine. I'm not against it. If you want to do it, that's fine.
But there is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite in the misuse or wearing a mask properly or fitting it properly or taking it off and all the other risks that are otherwise associated with that.
They shouldn't be doing, the general public is going out and buying masks. It actually does not help. It's not been proven to be effective in preventing spread of coronavirus amongst the general public. There was a study in 2015 looking at medical students, and medical students wearing surgical masks touch their face on average 23 times. We know a major way that you can get respiratory diseases is by touching a surface and then touching your face. So wearing a mask improperly can actually increase your risk of getting disease.
There are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you think masks, you should think of healthcare providers needing them and people who are ill. You cannot have the politicization of public health messages. I mean, the idea that wearing a mask or not became a political statement, that makes it beyond difficult to implement a good public health measure.
I'm waiting so that we can do a little political theater. Okay. So that it's on camera.
Thank you. Now people should not be walking. There's no reason to be walking around with a mask. Masks are not 100% protective. However, they certainly are better than not wearing a mask.
Told later in the spring to wear them when we initially were told not to.
Well, the reason for that is that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. And we wanted to make sure that the people, namely the healthcare workers, we did not want them to be without the equipment that they needed.
Do you believe that that's advisable and makes a difference?
You know, it likely does, because, I mean, this is a physical covering to prevent droplets and virus to get in. So if you have a physical covering with one layer, you put another layer on, it just makes common sense.
Since the start of the pandemic, experts have urged us to do three things: wash our hands, maintain social distance, and wear a mask all the time. Not when you feel like it, all the time when you're not eating and drinking.
So experts say you can double up with a tight weave fabric mask for added protection. Now, Virginia Tech researchers found that doubling up these cloth masks increases the efficacy from 50 to 75%. A 3-layer mask could block up to 90% of the particles.